think we're going to get started now. We're going to give a quick introduction, and then we'll go ahead and get started right with our speakers. My name is Ari Tamari. I'm a business development manager for Xsens. We're very excited about the turnout for this event. We've had more than we could ever anticipate in terms of our registries, and the attendance right now, we're up to 300 people attending, and that's just great. I'm so glad to see there's such an interest in IMUs and in biomechanics. This event is going to feature speakers from multiple research institutions who are going to share their work centered around using motion captures, and in particular using IMUs in new and innovative ways. Motion capture has always been an important tool in biomechanics research for quite some time. But traditionally, motion capture has been performed using optical cameras and passive body markers. However, with the emergence of IMUs as an alternative method of motion capture, we now offer a solution that is accurate, lower in cost, easy to use. These sensors allow, more importantly, the user to get out of the lab and into the field, and can be used in a variety of environments and for a variety of type of applications. IMUs are a very powerful research tool, and they supply a tremendous amount of data. Some of our talks will feature the use of this data along with using it in terms of deep learning and in AI in order to help predict clinical treatment outcomes, develop sport-specific training protocols, prevent injury, and we will also talk on to explore the validation of our sensor-based motion capture against other methods of evaluation. I'm going to pass it to Levi so we can introduce the first speaker. Before I do, I'd like, if any questions that you have, feel free to add to the question box. I also would like to add that we'll have a short question and answer period at the end of each of our speakers, as well as one at the end of the conference together. Because of the great response that we've had, and also we also would like to continue this on a monthly basis or quarterly basis. And for all the attendees, if you have any interesting topics or interesting work that you're doing with IMUs, please send your information to myself or Levi. Our emails are on the screen below our pictures, and we'd be happy to include you in the next conference. Go ahead, Levi.
Thank you, Ari. Thanks again to everybody for joining. We really appreciate it. And like Ari said, the amount of excitement around this event is so much more than we ever anticipated. So thank you all again. We're really excited to see this many people working in biomechanics and looking to see what other people are doing. So we are definitely going to have at least one more of these events before the year is over. So like Ari says, please reach out to us if you're interested in being a part of the next one. There may be multiple after that. A couple things before we get started with the first speaker. I'm seeing a few hands raised on the attendees list, or sorry, in our list. If you have questions, please enter them into the question bank. If they are kind of general questions, I'll try to answer them as the speakers are going. If they are questions specific to the speakers' talks, we're going to wait till the end of their talk, and they'll try to address as many of the questions as possible. If they don't get to them, we'll try to address those questions at the final Q&A at the end of the session. If not, we'll definitely follow up with you. We have a log of all the questions, so we'll make sure we get back to you on those. All right, everyone, we're about ready to kick off with our first speaker. One thing before I introduce him, I'm getting a lot of the same question about a recording of the talks. Yes, all the talks are being recorded and they will be available. They should be posted on our website tomorrow. We'll send you guys a link to access those videos if you want to rewatch them or share them with others. All right. Without further ado, I'd like to introduce Dr. Dylan Kobsar. I'm sorry, Dr. Dylan Kobsar from McMaster University, giving our first talk. I'm gonna hand over control to him, and Dr. Kobsar is going to take it away.
Thanks. Can you guys hear me?
Yeah, I can hear you, Dr. Kobsar. Thank you.
Awesome. Can you see my slides there?
Yep, slides look good. Camera looks good.
Okay, great. All right, well, thank you for that introduction. And thank you to Xsens for allowing me to give a talk today. And also thank you to everybody for attending this. I know we have a lot of virtual meetings and things going on right now. It's a crazy time, so I really appreciate everyone joining us today to talk about this. And I'm really excited to share some of my work and some of the work in the field. I think going first in this talk works out kind of nice because I'm going to talk about a little bit of background in this area and how these sensors can be used, and then talk about some applications and into machine learning, which will work nicely with some of the next presenters. So as you know, wearable technology is a huge business right now. There's estimated that about $34 billion will be spent in this industry in 2020. Whether this is going to go up or down with COVID, we don't really know, but it remains that this is a major industry. And most of the technology that we use for tracking motion relates to what we call inertial measurement units. And these commercial devices that we normally see that you can think of for smartwatches and all those devices out there that are so prevalent, for the most part, they're using these IMUs to track the quantity of motion. So they're looking at how many steps someone's taking in a day, how far they're walking. But the question is, can they do more than that? And I think if you are here at this talk today, you probably already know the answer to that, yes, they actually can do a lot more. And wearable sensors in general, whether it's looking at one of these very simple basic sensors that we can put together in the lab, or all the way up to an Xsens suit, they can do a lot more, and they can get at gait and human movement analyses in lab or out of lab. So they allow us to do some of the stuff that is really exciting in a conventional biomechanics space, but doing it outside of the lab. And really what that's getting at is trying to get at the quality of gait. So not necessarily just the quantity of gait, how many steps someone's taking, how far they're walking, but trying to get at the quality of someone's gait. And when we get at that, that gives us a lot of really amazing applications to a bunch of different areas. So some of the things that I'm going to talk about today in this talk relate to aging, to osteoarthritis, to running injuries, and many other applications as well. And so before I get into that, I thought I'd do a little search before this presentation, looking at some of the research in this area, because we know that wearable sensors, they're growing in these commercially available devices and in research, but to what extent are they actually growing? So I just did a quick search to putting together wearable sensors and combining a bunch of terms in that space with gait, human movement, exercise, and sport. So all these things that relate to this overarching term of using wearable sensors to track motion and apply it to different scenarios. And as you can expect, there's a lot of studies in this area. So there's over 9,200 studies since 2000. And what's even more important, you can see that this number is increasing quite a bit. So in the last 5 years, or about the last 5 years, that's where about 80% of these studies have been published. And even more so in the last 2 years, or approximately 2 years, about 50% of this work has been done. So there's a lot of work in this area, especially in the last few years. And you can see even in this partial year of 2020, so we still have about a quarter of the year left to go, and we're almost equal to the same number of studies that were published in 2019. So I really expect that that this growth of wearable sensor research and the application of wearable sensors, it's going to continue as we apply these in many more new innovative ways. And so then the question is, so what can we measure with these inertial sensors? If we go back to the kind of commercially available sensors that we think of in these smartwatches, a lot of times we're thinking of things like step counts or gait speed or how far someone's walking. But they can go all the way to, again, that Xsens suit or some of these really advanced algorithms where we can actually measure joint angles. But there's a lot of things that cover the span in between, looking at these basic daily step counts and all the way up to joint angles. So I'm going to talk about a few of these applications or a few of these things that we can measure with them. So first we can look at spatial temporal parameters. So really what this is we're looking at the timing and the spacing of our gait. So a relatively common concept is just looking at the timing of each step or the timing of each stride, how long a step is, so step length. And wearable sensors are really good at measuring that, whether it's at the back or at any of the lower limbs. We're pretty good at measuring that at any of those locations. And this is an example of some data collected from the dorsum of the foot, so on top of the foot here. And you can see this repetitive signal if we zoom out. If we zoom in a little bit, you can see it's relatively easy to pick out different gait events. I'm not going to get into the specifics of what each gait event relates to there, but you can imagine that with each step, we can pick out these events and compute things like step time, stride time, and other more advanced parameters as well. And looking at the average of those is quite useful, but also you can see here that there's very subtle fluctuations in all these. So we're able to not only look at the mean value, but we're able to actually look at the variability of it. So the slight deviation that happens with each step isn't exactly the same, and we can measure that. And what we know is that actually the variation in gait and the variation in some of these basic spatial temporal parameters can actually be an important measure of gait health. So in this case, we know that variability increases with age. So this is a study comparing young adults to older adults. And you can see just looking at basic variables like step time variability, so how much variation is occurring, we have much more variation in older adults than healthy younger adults. But I think even more important than that, if we look at a clinical population, so someone who's maybe at risk of falling, you can see that there's a much bigger distinction here. So this is an example of some work from Posendorf 2007. And here we have an 84-year-old non-faller, so a generally healthy 84-year-old. And what we're looking at is essentially each individual stride time that's being measured. So we have a little bit, again, some are longer, some are shorter. It's over, looks like about 6 minutes here. So we have this subtle variation in stride times. But then if we look at this 78-year-old here who's identified as a faller, so they have multiple falls, you can see that there's a lot more variability in these step times. So some are much higher than others, some are much lower, but overall we have this increased variability or maybe some unstable aspects of the person's gait. We can even go a little bit further into the long-range patterns of this. So this is a really interesting concept that the variation in these step times, it's not necessarily just random noise, but there's actually some dependency on previous steps. So the variation that happens is somewhat dependent on previous variation. And as people age or as they move into more of a clinical condition, the variation can become more random. And we see that in moving from younger to older adults. We can also apply this not only to aging, as I said, to fall risk, as we saw in that example there, to neurological disorders, things like Parkinson's, Huntington's disease. We see increased variability, and we see more random variability as well. And then we can go into things like osteoarthritis as well. So looking at how much variation is in that, and that could be related to pain, it could be related to a number of things, but we can track that as well with wearable sensors relatively easily. And then into running injuries as well. So looking at the variations in these spatial temporal parameters can be important in distinguishing between those who have pain or have an injury and those who do not. And then moving on from there, we kind of taking it now from just the basic spatial temporal parameters, but we can get into the actual magnitude of an acceleration. So having an accelerometer, in this instance, mounted on the shank or on the tibia, we can actually look at the impact acceleration that occurs. So after the foot hits the ground, we get this peak of acceleration, and we can measure that either as a resultant acceleration, and that essentially means it's just the overall amount of acceleration that's occurring regardless of the directionality of it. Or we can take it a bit further and look at a three-dimensional analysis of it, which means we can look at the amount of acceleration perhaps in the vertical plane, or in the medial-lateral plane, or in the anterior-posterior plane. And we can use this information to really not only track, but try to diagnose if someone may be at risk or looking to retrain someone going forward. And so one of the areas that this has a lot of application and that we see a lot of research in is in running injuries. And so again, we're looking to understand this impact in relation to potentially the bone stress or the stress on the joint. And you can imagine having high impacts for prolonged periods of time is probably not a good thing on the joint or on the bone itself. So we can track this and relate it to stress fractures potentially, to knee injuries, to anterior knee pain, things like that. And also to osteoarthritis. So again, we're looking at the health of the joint. And examining these impact accelerations can be really important in not only understanding the stability of the joint, of how much motion is going on through there, but the impact, potentially the loading that's going through that joint. And then moving on further from there, so not necessarily just looking at the peaks, so the actual magnitude of it, but we can look at the actual pattern of the acceleration itself, or that IMU signal. So things like autocorrelations, which we sometimes term regularity or symmetry of these patterns, is essentially looking at, rather than just a peak value, a peak acceleration, we're actually looking at the pattern of this. So as this trace, someone's walking, we can look at how similar this step here is to another step here. We can compute metrics relating to how similar these steps are to each other, which gives us some information on how consistent and how regular their gait is. Again, diving a little bit deeper than just the impact peak itself, and also into harmonic ratio, which is similar but a little bit different, where we're getting that sort of frequency components of the data relating to bilateral symmetry. And again, these have a lot of applications to a number of different things. So looking at aging, we see decreased regularity with aging, so more inconsistent patterns as people age. Getting into osteoarthritis, as people have been diagnosed with osteoarthritis versus healthy controls, we see differences in these patterns. In relation to pain and function, we see correlations and associations between these and pain and function. And then a really important one is looking at the response to surgery. So if someone goes through knee replacement surgery, are we actually improving the consistency and the regularity, and maybe even more importantly, the symmetry of their gait? And we can assess that with these type of measures. And then moving sort of all the way to the right on that continuum, where we get back to joint angles. So in this case, we're looking to replicate those conventional gait analyses that we would do in a regular or conventional biomechanics lab, where we have a full motion capture system. And so in this case, we require multiple sensors, obviously. So if we, for instance, attach a sensor to the thigh segment, we can measure the orientation of that thigh in space. And then if we attach a second sensor to the shank, we can measure the orientation of that shank in space. And using some advanced algorithms, some things that actually put those two signals together, we can look at the relative angle between those. So the angle between the thigh and the shank gives us this knee angle. And in doing so, again, we're able to replicate a lot of the stuff that we can do in a conventional gait analysis or a conventional biomechanics lab. And I'm not going to get into all the different applications, but you can imagine there are many of them. So we, again, can look at aging, fall risk, osteoarthritis, sport performance, and all of these other things that we commonly look at in a conventional biomechanics space. And so the next question is essentially, so we can measure all these things, but how valid or how reliable are they? How accurate are these things? And so we did a meta-analysis of a lot of papers looking at healthy adult walking with UBC. And what we found is, in doing all this work, we found that most mean spatial temporal parameters are pretty good at measuring what they say they're measuring. So if we're looking at things like step time and stride time, whether it's at the back, whether it's at the foot, these things do a really good job at measuring those. We see a little bit less validity when we get to more specific measures like swing time or even step length. But for the most part, they're all at least adequate or moderate in terms of validity, with most of them actually being on the excellent scale. And then when we get into the variability of these, so now we're looking at the variability between individual steps, not necessarily just the mean value at the end of, let's say, a 5-minute walk, and we calculate a mean value. We know that that works really good. But in terms of the variability coming out of that, there is a much bigger range of validity. So we see some studies will report very excellent validity or reliability, and others not so much. And it comes down to really a lack of consistent protocol across these, that we have very different ways to measure variability and very different protocols that people are going through for walking. And we see the same thing when we're looking at those measures that I talked about related to regularity and symmetry. They generally have good reliability, but again, we have some issues there which relate to kind of a lack of consistency in the protocols that we're using to measure them. And if we move to those joint angles again, so sagittal plane joint angles like knee flexion, we're very good at measuring those when it comes to these sensors, as well as frontal plane angles are pretty good as well. And the literature demonstrated that But what we also found is that there's a variety of different systems and different algorithms, which I'm sure everyone can attest to, that there's a number of ways that we can do this. But for the most part, looking at sagittal frontal plane joint angles relates to pretty good to excellent validity and reliability. But overall, what we found from all this work is that there's a lack of high quality and consistent research evidence across this literature. And it may not necessarily be a limitation of the device. We're not saying that the device is not consistent in high quality. We're saying that it's how we're using it sometimes. It's more so the protocols that we're using, not necessarily a limitation of the device. And so with that, I think one of the things that we need to focus on in this area is trying to improve our protocols and improve the consistency in our protocols across different labs, across different data collections, and also improve how we report those results, because that helps in furthering our understanding of the quality of these outcomes. And so moving on to kind of looking at wearable sensors and machine learning. So I think this is really the new frontier for biomechanics. It's really where we can do some really amazing things with wearable sensors and applying them to human movement. And so I wanted to kind of rerun this search, the same kind of search as before. Now we're looking at all these different types of wearable sensors. We're combining the search with gait, human movement, all of these different terms. But now we're adding in machine learning, artificial intelligence, deep learning, all that kind of stuff. So obviously we're going to have less studies, but I was excited to see what this actually looks like. You can imagine what it's probably going to look like. And when I ran this is exactly what came of it. So this relates to, again, the number of studies that are published with these three general terms here. And so you can see it's much less than it would be because we've filtered it to get only machine learning. So it's about 600, just over 600 since 2000. But again, what's even more important than how many are there is how many are there in the last few years. So in the last 2 years, we see 70% of the publications actually occurring. And again, similar to what we saw in that previous search, we actually see in this partial year, so in 2020, we've actually surpassed the number of publications in this field from last year. And so again, this tells us that there's this astonishing level of growth in this area of research, and they expect this to continue in years to come. And so what I wanted to do also is just give a little bit of an overview or background on machine learning itself before I get into a couple of applications of this. And so one of the broad terms that we use for machine learning is talking about supervised machine learning. Really what I mean by that is we're trying to develop models that have known labels. So we know what the people are, or who the people are, we know what the groups are, and we're trying to use that information that we collect to classify groups, and then hopefully to maybe be able to predict new subjects based on those groups. So there's a lot of different examples of using supervised machine learning in the literature. Here's just one very brief example from Dr. Christian Claremont at the University of Calgary. So looking at classifying using a wearable sensor during a marathon or during a long distance run, we can try to classify recreational runners from competitive runners. And again, using that supervised model means we know who the recreational runners are, we know who the competitive runners are, and we're trying to use the data to classify the difference between those and develop a model to do so. And then some of the work that I've done previously is looking at responders and non-responders in osteoarthritis. So essentially, if we have patients with osteoarthritis that go through an exercise intervention, we often see that some of those people go through the exercise intervention and they have great improvements in pain and function, which we would deem sort of a high responder or a responder. And then other people go through the same intervention and they really have no change at all, or maybe very limited change, which can be non-responders. And we can try to use their gait and some information about how their functional status to try to predict or try to classify these patients based on whether they're going to be a responder or a non-responder, and using either conventional motion capture analyses, joint angles, as well as functional status. We can do a really good job of that actually in this study, and we can also apply that to inertial measurement units, so we can get the same information by putting multiple sensors on a person as they're walking and trying to predict or classify and then predict who's a good fit for a specific program. So this this figure here kind of relates to that, where we're able to actually separate based on motion analysis data who are high responders, who are low responders that kind of fall somewhere in the middle, and then who are non-responders that really the exercise intervention has really no effect on them, or even can be sometimes a negative effect. And in making that model, we're also able to predict new labels. So in that research study, we were able to actually translate that to a prediction model, a clinical tool, where we can actually have someone come in for a gait analysis, go for a walk, and then at the end of that, through this model that we've developed, this supervised machine learning model, we're able to actually determine, are they a good fit for this program or not? So this person came in and go for a walk, we find out, yeah, they're actually, based on our model that we created, this person walks and presents themselves as a high responder, so they would be likely a really good fit for this program. On the other side of it, this person here doesn't really look like someone that would be a good fit for this program. They're probably going to not respond very well. So let's try to come up with a new intervention or a different intervention for this person, rather than just forcing them into the one that we really think probably isn't going to work. And then the other side of this is looking at unsupervised machine learning. So in this case, we don't necessarily know the classes of the people or the subjects or the patients in our study or that we're looking at, but we're just trying to cluster data without knowing what those labels are. So really another example of this is looking at running patterns. So looking at a large number of runners in a database in Calgary, you're able to separate and look at clustering two groups of runners. And what we found is that these runners here demonstrate a very different pattern at the hip. So they have more hip adduction than these runners here. But again, these are just two clusters. We're not looking at recreational versus competitive or injured versus uninjured. We're just looking at clustering and grouping people who have similar movement patterns. That's where the unsupervised piece kind of comes into this. And then another application, we're looking at something called the gait deviation index, which essentially is essentially like a multivariate deviation score, which relates to kind of a reference group. So in this example here, we have a reference group, which is healthy young adults, and we can develop this unsupervised model based on the pattern of motion at the knee. So looking at knee joint angles, knee moments that we have going on in the frontal and the sagittal plane. And we can develop sort of a normal reference group based on how these young adults walk. And then we can compare other adults to them. So we can enter in healthy older controls here, and we see that they walk different. They have a lower quality score, so they walk somewhat different than the young controls, but still pretty close at a 94 out of 100. But then when we look at people with osteoarthritis, we see that they're even further deviated from that young population. And we're looking at again, a significantly reduced score here. And most of that is occurring in this kind of frontal plane. And if anyone does research in osteoarthritis, that makes a lot of sense when we're talking about knee osteoarthritis and frontal plane moment. But one of the biggest limitations with all of this machine learning as it relates to biomechanics, and really a lot of applications to machine learning out there, not only in biomechanics, is the sample size of these studies. So you can imagine for that responder study that I talked about, where we have responders and non-responders, it takes a lot of time to get one single observation. So essentially, have to have people come in, do a full data collection in lab, takes a few hours, and then they go through an exercise intervention for months. At the end of the exercise intervention, they come back in and they do another data collection. This whole time, we've spent a lot of time collecting data on them, going through exercise interventions and then collecting data again, and now we end up with one single point at the very end of it. So it takes a lot of time to get this data, and that's one of the big limitations of all this work in biomechanics. But somewhere where I think we have this ideal intersection between wearable sensors and machine learning is looking at single subject models. So now in this case, we're not necessarily looking at an individual person as an observation that goes into our model, but we're looking at individual gait cycles perhaps, or time spans as a single observation for an individual. We can get thousands of these observations very quickly if we have a sensor on someone's back and send them out for a walk or a run for 5 minutes or 10 minutes or an hour. We can get a lot of observations. We can do this easily over multiple days. This can help us develop really powerful and robust models that are specific to one single subject. And so we can use these models to classify and predict, just like we could in the previous examples, but within an individual, we're classifying potentially things like speed and surface. Or we can do it in an unsupervised manner, where now we're clustering these patterns together. In this case, we look at developing sort of a typical pattern of how this person's moving and trying to track that going forward is a really interesting application of that. And so to kind of visualize what I mean by that, we can use this scatter plot here in 2 dimensions. All of these dots here relate to an individual observation. And again, what I mean by that in this instance, in this single subject model, is that relates to kind of one instance where one step or one stride, we're collecting data on how they're moving. And so we can get all of these observations and train a machine learning, an unsupervised machine learning model to determine what their typical range of motion is or what their typical pattern is. We just have kind of random variables in here right now, but you can imagine this could be anything. This could be impact acceleration and cadence, for instance, if we're thinking of runners. And so there's going to be some variation about those with each individual step. And if we collect this and run this model, we can see where they fall into next time. So now they go for another run or they go for another walk. They fall within that space and inside their typical pattern. That's great. They're moving as we would expect them to move. And then if we track them again, maybe they move outside of that range now. And now they're doing this something that's atypical. So they're doing something different than they would have before. And then the question is this relating to an increased risk of injury? Which is, again, depending on what we're looking at, could be possible. But it's really important to understand what those variables mean. And in here, it's pretty easy to visualize when we have 2 variables. We have x1 and x2. So it makes a lot of sense to just visually see it. But when we think of applying this to a high dimensional space, so now we're not looking at 2 variables on a scatter plot, or even 3, we can visualize 3. When we get into 4, 5, 10, 100, 1,000 variables that we're trying to describe a pattern of motion, it becomes very difficult. And that's where getting into the machine learning, the unsupervised piece comes into play more so than just a 2D plot. It's just a nice visualization of it. So I just want to give a couple other examples very similar to what we were kind of talking about here in relation to osteoarthritis and a marathon training program in runners, where we're tracking changes in these movement patterns with machine learning and wearable sensors. And so this is kind of similar to what I previously showed there, but the idea here is, again, we're defining this typical space of a person's gait, and we're able to collect information from all 3 of these sensors, the back, the thigh, and the shank, and determine this kind of holistic movement pattern and what their typical space is. We collect 2 different data collections, and we see that they all fall within this typical space. And then we can have we can define this as their typical, and we can have them go through an exercise intervention like we talked about before. At the end of that exercise intervention, we can see where they are. And for this individual, they fall right within that space again. So they really had no change in their gait. And for this individual in that study, they also happen to have no change in pain and function. If we look at another individual, the same kind of thing, we can define what their kind of typical is based on this holistic movement pattern, how they're moving, putting in a lot of different variables from those sensors. And then they go through their exercise intervention, and at the end, what we see is that they're starting to deviate from that pattern. So now they're moving away from their typical space. So they're starting to have a change in gait. And for this individual, we actually saw a change, a quite significant change in pain and function. And across the whole subset of subjects, we see that there is this correlation between how far someone deviates from this pattern and how much change they actually have in pain and function. And in this case, that change in pain and function is a good thing because we're putting them through this exercise intervention to try to improve their gait and improve their pain and function in relation to osteoarthritis. And then the last example here is looking at a marathon training program. So this is just a nice little case study that relates to some of this data, but kind of applying it in a bit more of an advanced manner. So now we have a lot of dots on this scatter plot here. So these aren't individual steps or individual stride observations. They're actually individual runs. So we have each one of these is a run from a different runner, but there's multiple runs from the same person in this space. And so what this allows us to do is to actually combine these 2 things in a really interesting way. So in this sense, we're looking at taking this unsupervised single subject model, which is kind of this space here. So if we were to define a typical pattern for an individual, so a lot of her runs fall within this space here, we're able to define this typical space for this person. But we can place it in context of a supervised between subject model. So now we can place it in this space, and we can see how that relates to, in this case, we have experienced female runners and inexperienced female runners, and how that relates to the pattern differences between those two populations. And so again, this is a little interesting case study to kind of demonstrate the potential of this. And so this is a runner in this marathon training program who goes for a run, and her gait falls. Every time she goes for a run, we get a point inside of this space here, which tells us she's running like her normal pattern. She's running typical, so she's running like herself because she's in her typical space. And then she's running like her community because she identifies as an experienced runner, so she's in the experienced runner space. And we can ask her how she felt at the end of every run. And in general, she's in that space. She was feeling good. So it's a green light and kind of go, everything's good to go. But after a while, she eventually moved outside of her space. So now we have this run here, this 1 day away from her run, she falls outside of her space. So she's moving atypical from herself. She's now outside of her space, her unsupervised model. She's outside of that space, but she's still within her community. She's still running like we would expect an experienced female runner to move. And if you asked her how she was doing, everything was fine. There was no problems there. She didn't notice anything. But to us, looking at the data in a more advanced way, we can see that something's up. There's kind of this yellow light scenario that something's going on here. And then the following week, we actually found out that she moved even further outside of that space. And now she's not only running like herself, she's very far away from herself. She's also not running like her community either. She's moving more like a inexperienced runner. And we see in this example, she actually had pain in this run and had to reported this at the end. But obviously, this is kind of too late at this point. So we have a red light scenario, but Jane obviously knows that she's having issues. So this is kind of too late. And so the idea is that with using wearable sensors and using machine learning, we can hopefully identify these changes before they become problems. And the way I like to think of this is very similar to a credit card fraud application. So you can imagine that with your credit card, you have a typical spending pattern. And when you're purchasing things, you're buying online, wherever you're using your credit card, the company knows your typical spending pattern and what is normal for you. And once you deviate outside of that pattern, if you deviate just a little bit, something that raises a red flag for them, then they notify you as quickly as they can to say, hey, something's up, we should check on this. And that's really what we're kind of doing here is we're tracking the movement pattern, and we're trying to raise the flag before, in this case, you move into a space that is injured, where you have an injury, or in this case, you have someone steal your credit card information, or you have them steal your, make a lot of purchases on them. So it's, again, this very similar idea with that. And so just to kind of wrap up here, in terms of future applications and challenges, I think the integration of wearable technology and machine learning, it has a great opportunity to lead to innovations in solving musculoskeletal and human movement problems. But there's a few things that I think we need to focus on going forward. One of them is to try to make these outcomes interpretable, meaningful, and actionable. So I showed versions of this type of figure a couple of times throughout the paper, and it's really helpful information in understanding changes, but trying to put this in such a way, put this high dimensional space or this machine learning, this black box machine learning applications that we can do, trying to put it in the context of these normal spatial temporal things that we generally can get people to understand pretty well, or even into the joint angles, which clinicians are pretty good at understanding as well, trying to make these interpretable for people and also actionable, so we can give them something that can actually help keep them in that healthy zone and not move out of it. And then advancing these measurements into free living conditions. So there's a lot of work going on in this space. Essentially, the idea is that we want to be able to collect raw movement data from sort of everyday living. There's a lot of research that looks at classifying activities. So we can classify things as walking, as running, as stairs, and things like that. And then we can segment that data and do more more detailed analysis in each one of these segments. There's a lot of research in each one of these areas, but I think the important thing is creating a complete top to bottom system that can take that and go all the way down to these actionable and meaningful outcomes. And the next thing is defining normal day-to-day variations or the meaningful changes. This is a figure from Dr. Lauren Benson's work in the University of Calgary as well. And essentially, we're looking at a number of runs, collecting some different variables during these runs, and we can see that it takes a number of runs to actually determine what someone's typical pattern is or how much variation is normal for this person from day to day. And so we need to really understand how much variation is normal so that we can understand when a meaningful change occurs, so that we don't simply have some minor day-to-day variation and think that something is going wrong when in fact it's just general day-to-day variation. But understanding those variations and how it applies to different things, running, walking, osteoarthritis, aging, things like that. And then lastly, and I think most importantly, is integrating this with other data sources to develop patient-specific models. So with these sensors, we're generally living in this mechanical space. So the biomechanics, we're living in this mechanical space, and we're able to do a lot of really amazing stuff in this space. But it's important to keep in mind that this is just one aspect of the patient. So we're representing how they're moving, the mechanics, the loading potentially of their knee or of their lower body. But there's other important things going on relating to neurological symptoms they may have, psychological, biological, and clinical things. There's all these things that make up this unique patient. And we have to remember that this is one aspect of it, and putting this into the big picture context of helping this patient is really how these models can make some great advancements in the field. And so with that, I'll say thank you and answer any questions anyone may have.
Thank you so much, Dr. Kobsar. We're going to address a couple of the questions that come in. We'll try to get to the talk-specific questions first,
Okay.
And then we will address the rest of them towards the end of the webinar. So the first one, what were the sample sizes in the publications you spoke to when discussing machine learnings? Have you seen a threshold sample size needed to achieve quality machine learning algorithms?
Yeah, that's a really good question. So I talked about sample size as being a big limitation, and in any of those publications, you know, first limitation in that paper is sample size. Generally, we try to get to 100 for developing some of these, but I would say some of them are around the 50 mark. But obviously, more is better. There's not really there's models you can put together to test. We can do learning curves and things like that to test similar to kind of the sample size calculation, but there's no really great answer to that question of like, this is how many we need. In general, we try to get 100, but that's, again, that can be really difficult for some of those applications.
Apologize. Wow, we had a lot of questions come in. I'll try to get to as many of them as possible. We are running a little behind schedule. Here's one. How do you anticipate using these machine learning findings to make specific recommendations when interpreting the biomechanics behind some of the machine learning outcomes?
So yeah, it's a really good question. It's something we kind of think about a lot. So I think there's kind of two ways. One is what we talked about is the red flag, or the identifying a problem, where we might know what that problem is, but it at least directs them to dive deeper and maybe get a full data analysis. And then I think the other one relates to kind of need to tie these outcomes, these more, again, black box outcomes, to tangible things like joint angles, like loading parameters, and have a better understanding of that. And we just don't really have that as much as we should now. We're able to track these things really well. It's kind of the space where wearable sensors in general. We can measure a lot, we can track a lot. The next phase is to really make these interpretable and actionable. But I think that's a really important question.
And then our last question for this session is going to be, how much is already known in human gait analysis concerning with parameters that are useful for monitoring orthopedic health and diseases?
Sorry, what was that question again? Can you repeat it?
How much is already known in human gait analysis concerning which parameters are useful for monitoring orthopedic health and diseases?
Okay, so I can speak to osteoarthritis, for instance, but there's a lot of work in osteoarthritis in looking at in relation to surgery or progression of osteoarthritis. One of the big factors that we look at in osteoarthritis is the knee induction moment. That's kind of the main outcome that we think of as this gold standard, is looking at knee induction moment. And we know that greater knee induction moments lead to people are more likely to progress in osteoarthritis. So if we can get at that as kind of this this main outcome, that's the one in osteoarthritis. But obviously, there's a lot of other things, because that's just looking at the knee. We can look above and below, and there's a lot of other things. But in terms of osteoarthritis, I think that's kind of the main one that we would think of.
Great, thank you so much, Dr. Kobsar. I apologize we didn't get to your question just right now. We are running a little behind schedule. I'll try to address some of these questions at the end of the talk. And if we don't get to it, we'll make sure we share your questions with Dr. Kobsar, and I'll get you guys your answers. All right, great. That looks like all of the talk specific questions we have. So before I jump into the more general questions, I just want to thank Emily and the rest of our speakers. Thank you so much for participating today and sharing your research. This is really great, really informative. And I think it's a great start, great way to kick off this web series that we want to do. So if you are interested in participating, interested in sharing your work with IMUs, please feel free to reach out to Ari and myself. And thank you again to our speakers today. We do still have a handful of questions that have come in, so I'm just going to address them as they came in. Some of these were from a little while ago. Hopefully you guys are still here. Does it matter where the sensors go in relation to the three axes of movement, meaning if they go back on the back of the foot or on the malleolus, for example? So yeah, so that's a really good question as far as using IMUs go, and that's going to kind of depend on how you're using the IMUs. If you want to use them by themselves, looking at simply that raw IMU data I referred to earlier, it does matter because the orientation is going to change from session to session. It may also change just depending on the shape of the foot for individuals. If you're using a more comprehensive tool like a full body set, where you're going through a calibration similar to how the Xsens MVN software works, the sensor placement doesn't matter quite, I should say the pinpoint placement doesn't matter quite as much, because in that calibration process, you're going to be zeroing out the orientation and the values that that sensor is going to report for you. So if you have a little bit of variability as far as where they're placed on the rigid segment, it shouldn't affect your results all that much. This is a general question for IMUs. In our lab, we use a set of 12 IMUs, and we're using it to quantify movements from very young infants, less than 1 year of age, and we record how they interact with their parents who also wear sensors. Is it possible to measure proximity between the sensors? That won't really be possible, particularly between two separate people wearing the sensors, just because it's position from inertial motion capture is calculated as opposed to being measured directly. So if you had two different people wearing a single sensor, you wouldn't really have an accurate way to calculate their position in reference to each other. What you could use is a positional aid tool similar to HTC Vive, which is one of the tools that we use at Xsens to help with that position tracking. But with the IMUs by themselves, that wouldn't really be possible to do in an accurate way. This was a question for Dr. Kobsar. He's no longer here with us. I'll do my best to answer. But what do you think about using single subject models to infants who are not able to walk yet? If we measure their sensor movement at different time points, for example, every 2 weeks, do you think that we can try to use machine learning to find movement patterns changing over time? This will be a question. Oh, Dylan actually has popped back in. Yeah. So
yeah.
Would you like me to read that back?
No, I heard it there. Yeah, I think that's a really interesting question. I actually have a 5-year-old and a 3-year-old. and it is interesting to watch them develop their movement pattern. And there's no research that, from my understanding or from what I know, there's no research that has really looked at that. But I think it is a really interesting application because when we track, fully developed adults and we're looking for deviations in their sort of typical pattern, those deviations are generally pretty minimal, or they're they're related to something very specific. But if we're looking at an infant or a very young child, these deviations can be quite significant as they develop, as their central pattern generators start to take over and they're developing these more advanced movement patterns. I think it'd be really interesting, but I don't know much work in that space. I don't really have a great answer for it, other than I think it would work well, and it'd be interesting to see what comes of it.
Great, thanks for popping back in. We do have another question here we weren't able to get to at the end of your talk. It's great to see how much ground wearable sensors are gaining, that AI is being applied increasingly. When applying machine learning, though, what platform did you use to create a structured database with your data so you could apply those algorithms?
So most of the work that I've done throughout, a lot of the stuff that we talked about there was through MATLAB. Working a lot more so in Python now. That's one of the big transitions for my lab now, is looking to move from MATLAB to Python. We still use MATLAB quite a bit, but I think going to Python has a lot of advantages, obviously. In terms of the database in Calgary, where a lot of that, or some of that data is held, there's a pretty extensive database that is SQL based, I believe, and it's through, it essentially brings in data that we collect in the clinic or in the research setting, and then it also brings in data from all around the world. So Dr. Reid Ferber has sort of has this large database that brings in, again, data local to the University of Calgary, and then from clinics all around the world who are using very similar systems. So he's kind of a huge expert and a great person to talk to when you're thinking about those type of like large multi-center databases. In terms of the analysis in the machine learning models, that's more in the MATLAB Python area though.
Great, thank you. And then I believe we have one last question that was specific to your talk. What are your thoughts on implementing a force or pressure sensor in combination with the IMU system, for example, in the heels and the toe? Yeah,
so there's actually a lot of really interesting work that uses the combination of those two. So we're actually working on looking at all the kind of wearable sensor work in osteoarthritis going on right now, and there are a lot of applications where we essentially take the wearable sensors to get more of kinematic measurements, to get joint angles and things like that, and then integrate that with force sensing resistors or some type of in-shoe force measurement, and try to get back to that I talked about before, like the knee adduction moment. So there's a number of sort of advanced deep learning, machine learning type applications which implement those two, and they seem to work pretty well. We haven't done that ourselves in the lab, but I know that there's a lot of groups out there that are doing some really awesome work in that space.
Great, thank you. Looks like we had a few more questions come in for Emily, and I believe she's still here. Thank you, Emily. Let's see, where to go. Do you think that a movement competency screen is an effective tool that can be used knowing risk of injury during this quarantine?
Sorry, can you repeat that one more time?
Sure. Do you think that a movement competency screening is an effective tool that can be used knowing the risk of injury during this quarantine?
You know, I don't know if I'm familiar enough with movement compensatory screening to give a good answer to that. But I don't know if this is related to the question that was being asked. I do think it's exciting that wearable sensors, at home, at work monitoring, remote monitoring of the wear and tear on our body is a really exciting space, and it's all the more applicable at times like right now.
Great. And then, so this question said, you mentioned ankle force measurements as an input to some tibial damage calculations. Are taking measurements of the ankle force, are taking measuring ankle force measurements better understood than tibial damage? Is there a reason that was selected as one of the inputs? And then did you collect those or use measurement calculations from another study?
Yeah, thanks for the question. For our analysis, we used peak tibial compression as our key metric for looking at tibia damage, because previous studies that have looked at how stress fractures and bone stress injuries are modeled as a mechanical fatigue process have shown that the peak cyclic loading is a key indicator of that damage accumulation. And given that tibia compression is one of the primary loading regimes on the tibia, that is what we chose to focus on. In our study, we estimated that by combining the motion capture, ground reaction forces, and a model of the lower limb to estimate using that lab-based data, tibia compression, and then we focused most on the peak tibia compression.
All right, great. Looks like the rest of these may be more IMU specific. Do we have any more questions for our panelists while they're still with us? I'm happy to address the IMU questions afterwards. Okay, I'm just gonna go back towards the top. So we're asked, can this be applied to swimming? It can be, depending on what you're looking for. You would obviously need an IMU that is waterproof. Xsens does make a waterproof IMU. We call it the Xsens dot. So depending on what kind of outcomes you're looking for and what kind of metrics you're looking for, that can definitely be a very useful tool for you. So we were asked, with the full body system, would there be an effect of, or would there be interference from using other systems such as EMG? And so, like a lot of these IMU questions, I can speak to how it affects Xsens. So Xsens actually would not be prone to any interference from EMGs or really any magnetic distortions. Our motion capture engine is actually actively reading the environment to make sure that we're able to compensate for any sort of magnetic distortions. So there's actually quite a bit of work that's done with our sensors alongside with EMGs in real time. So we're actually able to sync with them. So make sure you have your time sync data and possibly even working towards integrating with some of our some of the EMG companies. So I was asked, where will we be able to find the recordings on the website? So we will post the recordings of all the talks today on the Xsens website. We have a page for our webinars, but we'll also send out a link for where you can find them. They should be available tomorrow. So we're asked, what's the sampling frequency of the Xsens dot? Is it a 9 degrees of freedom sensor, and what sensor range does it support? I'm not sure what you mean by the sensor range. It is a 6 degree freedom of sensor, sorry, 6 degree of freedom sensor, and the sampling frequency is, I would have to double check, but I believe it is 1,000 hertz, and it's run through our strap down integration, and the data is actually output at 60 hertz. As far as the range that does it support, if you mean physical range, it does use Bluetooth, so it's going to be limited to the BLE 5.0 range, which can vary depending on device, but we're talking maybe about 15 to 20 meters. Looks like we have another question, combines both Dr. Kobsar and Emily's talk. Can the machine learning algorithm used with respect to marathon training be applied to identify risk of injury?
Sorry, there we go. Yeah, I think that's kind of the like a really good end goal application of it is really we're trying to get at risk of injury. Similar to what I kind of said at the end, that it is a difficult thing to get at because there's a lot of variables that speak to risk of injury. But I think from a sensor and a biomechanical standpoint, I think we can develop some metrics that can support that, right? We're never going to develop machine learning algorithms that are going to get 100% accuracy in defining if someone's going to get injured or not. But it's about supporting that and helping to improve in that, in those estimates, and helping people kind of change how they're training a little bit. So I think that's kind of really where it can help out with, yeah.
Great, thank you, Dylan. Do you provide a global positioning suite in order to monitor the global position of the person wearing the Xsens suit? And what is the price point estimate? So we do provide a global positioning aid or absolute positioning aid, depending on how you'd like to define it. We do have a GPS integration with our, what we call our MVN Link suit. That's going to be the full body suit. Some of you may be familiar with. And we also integrate with HTC Vive, which is classically a VR tool, but we now sync with it to help with absolute position aiding, so you don't have any positional drift while using our system. We don't directly sell the HTC Vive tech, so I wouldn't be able to give you a price for that. It is pretty widely available. I've seen it on Amazon, I've seen it on Newegg, I believe even Best Buy sells it. So that would be where the price point for that would have to come from. We're asked, how is the synchronization with force sensors like the insoles being done? Through Xsens, that can be done a few different ways. Our system is able to receive TTL pulses from third-party devices. It's also able to send them out. So it can be done just using one of the BNC ports on our receiver station. If you weren't able to set up that way for whatever reason, you could also use a timecode sync. So you actually have that absolute master clock separate from your computer and your other devices, and that way you can sync the data in post-processing. So a few different options there. I think that may have been most of the questions that I'm at least able to answer right now. If I wasn't able to answer some of your questions, I did send you a message, or if I didn't send you a message, it just means I'm not able to fully answer that question at this time, but I will make sure that I follow up with you and get those answers. If there are any remaining questions, feel free to throw them into the chat or into the question box. But if not, once again, I'd like to thank everybody for joining us. As Ari and myself said at the beginning, the turnout for this event is far surpassed our expectations. So we're very happy with that. We're very excited to bring this for you, excuse me, and give all of our speakers an opportunity to present their work. We're looking to do at least one more of these before the end of the year. If you're doing work with IMUs that you're really interested in sharing, please reach out to us. You can see my email address at the bottom of the screen. Ari's had his displayed earlier. Or even you can send an email to info@xsens.com, and they'll make sure they forward the message to us. We're asked if I can provide a link to the global positioning system you mentioned. I will reach out to you individually, and I will send you some information about that. And I was also asked about certificate of participation. We'll send out an email thanking you guys for coming out to our webinar, and hopefully that works. If not, just send us an email and we can see what you need to get that. And kind of last call for questions. All right, looks like that's all of it. Once again, thank you, everyone. Feel free to reach out to either myself or Ari with any questions. If you do have questions that you didn't get to ask to our panelists, feel free to send them to us as well, and we'll make sure that we get them to you, get them to the panelists, and then they will be able to follow up with you. Thanks again to all of our panelists for participating and sharing their work. I hope everybody has a great day. Thank you very much.
want to thank everybody for coming. If you'd like to learn more about IMUs or more basic information, feel free to contact Leela and myself. We'll be happy to set up a live demonstration of the Xsens products or hopefully answer your questions. Thanks again to everyone that showed up. They're wonderful talks.
Great. Thank you, everyone.
Thank you.